Hi, welcome back to Spotlight. I'm Selene Rodriguez, Campaign Director for TPPF's Secure and Sovereign Nation campaign. And today I'm joined by Dr. Tom Oliverson and my colleague Brooke Garner. Thank you both for being here today. We've got a very exciting discussion of something that is pretty trendy right now and for different reasons. We're going to be talking about the price of immigration, both legal and illegal, on Texas healthcare systems, which Dr. Oliverson, I believe you are uniquely positioned to talk about with us today.
Sure. Yeah. I mean, I've seen it for years, both I see it as a lawmaker, but I also see it as a physician in my own practice.
A lawmaker and a physician. So let's get into that. Dr. Oliverson, you are a state representative for House District 30, and you're a practicing anesthesiologist, correct?
I am. That's right. And I like to do labor and delivery. That's like my favorite part of being an anesthesiologist.
And a big part of what we'll be able to talk about today. Yeah. You are currently a member of Appropriations, the Appropriations Subcommittee on Article 2, Environmental Regulations, and the Select Committee on Health Care Affordability. And you also are the chairman of the House Republican Caucus.
That's right.
So lot of credibility here. Brooke, you are our current policy analyst, correct?
Policy scholar.
Policy scholar.
Yes, ma'am.
Well, that could change soon. For our
Policy
healthy
expert.
policy expert, right? For our Healthy Texas initiative. And so you're going to bring in some stuff that I am not very well versed on here to this discussion. So I'm really looking forward to getting into this. Let's just start at the top here. So Governor Abbott signed an executive order last year, correct? Mandating that all publicly funded hospitals have to start gathering data on how much we're spending for illegal aliens in the state of Texas. Why did we even have to do that in the first place?
Well, because we do, and we spend a lot. And in full sort of defense of the state and defense of the hospitals that provide this care, I should begin by pointing out that the vast majority of this care is provided through the emergency room or through labor and delivery, and that care is obligated to be provided under a federal law known as EMTALA, which is the Emergency Medical Treatment and Labor Act. And what that law says is, regardless of a person's ability to pay, if a person shows up to an emergency room or if a pregnant woman shows up in labor, then you have to provide all the medically necessary care until that condition is stabilized or resolved. So I think the corollary to that, obviously, is that's a huge unfunded mandate on every single healthcare institution and provider nationwide, in the case of somebody who's completely uninsured, right? So it's like, you're going to provide the care, no expectation of payment, but we expect you to provide whatever's necessary.
And where is it that you practice medicine?
So I practice in Harris County, northwest Harris County, outside of the city of Houston.
I think that's notable because I'm from the Texas-Mexico border. I'm from a small town in southwest Texas, and it's so normal, like growing up in these border towns, that everybody gets just access to the limited healthcare infrastructure that we have in these small towns. So we have a port of entry, and if a Mexican national makes it to the port of entry, then they have to call an ambulance, and then there goes the ambulance to pick them up, regardless of what the situation is. And where I notice this is very common is with pregnant women. And you have doctors on the Texas side that coach their patients who live in Mexico. You know, if you tell them you've soaked this many pads and you're this many months pregnant, they're going to let you in, and then we'll induce you and you'll have your baby here. Yeah. And sometimes they stay in Texas. Sometimes they go back and get public benefits from Texas while living in Mexico. So you said you really like to do the maternity side of things. Is this an issue you're seeing outside of the border as well?
Oh, yeah. I will tell you, I practiced for years at a hospital in Houston, on a different part of Houston. I won't name names, but we actually had a obstetrician there who basically advertised in Mexico, hey, if you can get here, you pay me, $500 cash, and I will coach you. I will provide all your prenatal care, and I'll take care of you, but I will also coach you on how to get into the hospital and get basically all of your care provided free, including your anesthesia care.
So we talk about this free care that you're getting. Brooke, is this what we hear all the time, uncompensated care?
Yes, it is.
What is uncompensated care?
It's care that is given out that the taxpayers are going to pay for in the end. So it's not free whatsoever. Yeah,
so I think it's very normal when average Texans are listening to things about healthcare. If you're not working in that industry, you're kind of like, okay, whatever. Like, I'll just leave that to the experts. Well, you're an expert. Why should everyday Texans care about uncompensated care and the increasing costs that we're seeing within it?
because it is all connected. There's a reason that healthcare is so unaffordable right now and so high, and this is part of the reason.
And so that ties in two big things right now. Birth tourism. Big topic here in Texas. Governor Abbott recently targeted it, rightfully so. Started in the Rio Grande Valley, but you're saying that we see this all over Texas.
100%.
What's going on here?
Yeah, I mean, and actually, we probably see it all over the country, honestly. Our main port of entry, obviously, is from the southern border, and so we tend to see more Mexican, Central American folks coming across. But you know, there's a huge pipeline in California for Chinese nationals to come and experience the full birth tourism thing. And you had mentioned before, which I think is absolutely on point, you know, sometimes they come across and sometimes they go back, right? But they get the care here in America, but they also get an American citizen baby out of the deal because of the I would argue the completely inappropriate way that we've interpreted certain amendments to the Constitution, right? And we recently had Supreme Court weigh in on that. But setting all that aside, like that is a draw, right, for people to come here. But then on top of that, we make it really easy. As you said, as soon as they get to the port of entry, if they're in labor, they're getting put in the back of an ambulance and literally ferried to the hospital, where no expense is spared to essentially make sure that that is a completely uncomplicated, healthy delivery. And oh, by the way, here's your American citizen birth certificate for your child. I mean, that's a good deal, right?
Yeah. You say no expense is spared. Sorry, were you going to say something?
Oh, no, I was just agreeing. That's a great deal right there.
So, and if I could just say one other thing. So, like, my dear sister, who's unfortunately departed, died in a hospital in Spain. She was insured, but it was American insurance. So we, as her family, she was very, very ill, had to pay cash and then submit a claim after the fact to the insurance company for reimbursement. They didn't provide care without payment in Europe. You couldn't just walk into a hospital and demand free care, right? Like they were like, okay, well, yes, we'll take care of the emergency, but she's in the ICU now. How are you going to pay for this? So it is not the case that other places that you can go where you could just sort of walk in and sort of get all this care free of charge with no expectation of payment.
Right.
That's the absurdity of all of it. Do you know that we provide this care to people under the emergency Medicaid program, and then when they don't qualify for Medicaid because they're not going to, because they're not American citizens, we just write it off. The taxpayers just suck it up. You know, there's no attempt to go back and say, well, should you pay this back?
Well, on top of that, you know, it's a lot of money that we're not getting back, but also tracking. So the governor signed the executive order. I think I saw within that first report that came out was over $1 billion in less than a year. I think that I've taken my kids to the emergency room a couple of times since that order came out, and it's just a part on the registration that says, are you a U.S. citizen? Yes, no, or decline to answer. And that's really all it is. So I could say yes, or I could just hit decline to answer. And who's going to know, especially if I have fraudulent paperwork, which is very easy to get, especially in border communities. So we're starting to get an idea of what this cost is. But how can Texas move forward and really fix that to close those loopholes, to get a better idea, and to make sure now that we're actually doing something about it?
Well, there are several things that we can do. And I'm not the only person working on this. Some of my colleagues are also working on this. I know I was talking with Representative Candy Noble has an idea that she's working on. But you know, when people come over here on a work permit or being sponsored, there is basically a contract that's entered into with the government and the employer, with the understanding that that individual is not going to be a burden to our public welfare system. And yet we don't go back to the employer and ask them to pay back that which that employee has gotten out of the public system, but maybe we should, right? There are certain issues, and you could probably help me with this a little bit, but so if you go back to the One Big Beautiful Bill, one of the big things that came out of that was a change in the continuous eligibility requirements for Medicaid. And essentially it used to be the case that you get 90 days to prove that you're eligible. And during that 90-day period, you essentially have temporary Medicaid and benefits can be paid on your behalf and such. But what people used to do is just sort of string those together, and as soon as one expired, essentially file for another one and another one and another one and another one. And so now states have the authority to basically cut it off after one. And so we had sent a letter, myself and many of my colleagues had sent a letter saying, like, this is the guidance now from the federal government with regards to this program. We should not offer additional periods of eligibility after that first 90 days. I think we should go even further than that. I think if you complete the application and knowing that you are not going to qualify, I think we should recoup the money that's paid on your behalf during that 90-day period. Why not?
What would happen if they don't pay that money back? What's the mechanism there?
Well, I think the mechanism, as I would envision it, is that the comptroller has the ability to garnish their wages until they do pay it back.
I like out of the box thinking.
It wouldn't be the first time that the government essentially said, you have an unpaid debt to the government. Hence, we're going to collect that debt, right? The IRS does that all the time. Especially in a situation where somebody fills out an application fraudulently, knowing full well that they're not going to qualify.
So into that and repaying and fraud, Brooke, your team has been working on some possible legislative solutions on sponsor repayments. Can you tell me a little bit about what that idea is?
Yes. So similar to what Dr. Oliverson was saying was that when a immigrant comes here to the U.S., they sometimes get sponsored, and they have to sign a contract that they are above a certain poverty line and that they will not be using any of our welfare. In 2019, CMS issued a rule that the states are allowed to get that money back from sponsors if they lied or committed fraud and their immigrant has used our welfare. So we are working on legislation that actually allows us to enforce this rule and get money back for Texas.
Is that something that any other state has pursued yet?
Not yet, and it's being pushed by the Vice President's Fraud, Waste, and Abuse Task Force.
Wow. What has there been anything else come out of that task force as far as like how states can tackle this issue specifically in healthcare?
That is the biggest one as of right now, but I do know that in the future they're going to come out with some more proposals.
Okay. And talking creatively here, you've had a really great suggestion earlier. You're also looking into some abuses in the CHIP Perinatal program.
Yeah. So, whereas the federal government would say that, emergency Medicaid would apply in a situation where a medical emergency exists or labor exists, we have programs in Texas, you mentioned CHIP Perinatal, that don't actually have a citizenship requirement in order to be a participant in the program. They look basically very similar to or identical to Medicaid in terms of the financial requirements, but whereas in order to qualify for Medicaid, you'd have to prove citizenship. With CHIP Perinatal, you don't.
So
ask the question, why would you have a program like that provides essentially up to 18 or 20 prenatal visits, labs, ultrasound, the whole shebang, essentially all prenatal care needed for somebody to have a healthy pregnancy. And I'm sure that was the reason they did it, right? Is they're going to show up to the ER regardless, so we're just going to give them the maximum amount of care that we can so that they have a good pregnancy.
And is it Medicaid in general? I know you have to prove you're a citizen or like a federally protected designation. So like an asylee or a refugee, or you're on some sort of protected TPS status, temporary protected status. Do they skirt those? Like, are we seeing a lot of fraud in the system because they're saying that there's something, or more so, we saw under the Biden administration a lot of abuse of using those types of statuses. So now we see in the courts that they're trying to get rid of the temporary protected status for Haitians, right, or for Venezuelans. Mm-hmm. But that's all administrative policy. I mean, that can come and go by president. So how does that affect when you're trying to enroll in these programs and you're using one of these statuses, and doesn't that kind of bounce them around too?
Well, I mean, I think if you could qualify for Medicaid, you wouldn't need to enroll in CHIP. perinate, right? Because if you think about it, CHIP is really more of a children's health program anyway. And so this is obviously, it's a different route you can go. Now I'm going to tell you, like, I have seen patients who are on CHIP Perinate in Texas that are clearly American citizens. But my own anecdotal experience taking care of these patients is that there are quite a few times where it seems pretty obvious that they're not, right? We have to get the translator service, and they basically identify that they recently came here from outside the country, have been here less than a month, or less than whatever, and you're sort of like, that's interesting, and it always seems to be CHIP Perinate. If it's an emergency Medicaid, usually that shows up as like Medicaid pending, or emergency Medicaid, and then okay, well, but that just covers labor and delivery, right? But the Perinate program is unique because essentially it provides all the antenatal. So essentially you're making it as easy as possible for somebody to have a baby here free of charge, completely taxpayer funded, and embrace birth tourism. Like literally don't have to wait till the ambulance has to bring you from the port of entry. Like you could cross over and just not go back very early in your pregnancy and qualify and get the whole thing paid for.
Which you see all the time growing up on the border. And I never knew this was a weird thing or a bad thing until I left the border. And then I moved to California, which is just a different part of the border where this is also a huge problem because I was in Southern California. When I started working in this, I thought, this is probably not good for Texans and for all of the other states that have to deal with it. Brooke, if we were to get a better handle on the cost here that is costing all of Texans and all of Americans really, because this is not, like you said, not just a Texas problem, how would that benefit American citizens?
We would actually have a better Medicaid program because doctors would be able to use it and actually process the patients that are going through it. Right now, lots of doctors do not even want to take Medicaid, Medicare patients because there's so much fraud within it and it's so hard to get reimbursed. So it would improve that in the administrative aspect for doctors and also help taxpayer money actually go to U.S. citizens who truly need it.
Great point. But what we hear a lot to that in my line of work is, so you just don't care about people. You don't care about babies and pregnant mothers because you want to take their health care away. And, the health care is a human right argument. What is your counter when you hear things like that?
Look, I'm very compassionate. I take care of people. I had well, I don't want to go into details, but I was on call last night at the hospital, and I had some very, very traumatic things happen with regards to people coming in pregnant and being in dire straits and, had to get the translator, clearly, had avoided the hospital, avoided prenatal care, whatever, took care of them. I mean, we are compassionate people. I think it's fascinating to me that healthcare is one of those only industries where there is an assumption being made that it is okay to take the fruits of somebody else's labor for free without any expectation of payment because it's compassionate to do so, and that they're supposed to just be okay with that. I asked myself, like, how many attorneys at the end of the day would provide services to you, free of charge to do your will or whatever, right? I mean, how many people would build you a house as a builder free of charge, and you're just because, I can't afford to pay, so therefore I don't have to pay. It's frustrating to me that in healthcare, not to say, and I think maybe it's because healthcare providers are compassionate, that policymakers and people outside of healthcare completely take that for granted. It's like this completely elastic, inexhaustible elasticity of someone's compassion, and so I can literally get them to do anything I want because after all, they're taking care of people. And so they're not going to complain about not getting paid. They're not going to complain about, sort of being taken advantage of. I mean, the example I gave you earlier. So here's a situation where the person that's essentially helping them with the birth tourism part, who is a physician, is getting paid. But the others are not, right? And so he's ensuring that he's getting his cut, right? But others in providing the care to that person are essentially doing it without any real expectation of payment, probably won't. Now, they might get something after the fact from emergency Medicaid, but it'll be pretty low, just sort of like a, hey, thanks for playing sort of thing. And that really aggravates me, right? Because I feel like everybody that I know that's in healthcare cares deeply about people. But there's a part of them that's just sick and tired of being taken advantage of because they are compassionate. And if you think about it, that literally is what this whole issue is really all about, right? We've created a system, and a safety net system that is supposed to be there in an emergency so that nobody falls through the cracks. And the reality is what it's turned into is a super highway for birth tourism that is just getting the crud abused out of it, out of compassion. Like, we do it because we're compassionate and because we care and because we don't want to be seen as uncompassionate, right? The state's like, oh no, we take care of people. But the reality is, like, we are being abused as a state. People are abusing the system massively, committing massive fraud, because we're compassionate. Mm-hmm. If we were uncompassionate, that it wouldn't be an issue, right? So it's just sort of this chicken and egg sort of thing.
This idea of suicidal empathy.
Suicidal empathy. Mm-hmm. That's exactly what it is, right?
It's gotten
not the only place that we see this in our country right now, mm-hmm. but that is clearly what's going on here. So I think, yes, we'll stabilize you. Yes, we'll provide care for you. But at the end of the day, like, I think because you're not a citizen and because you're not entitled to these benefits and services, there's an expectation that you should have to pay that back.
In talking on paying it back, we talked about the governor's executive order. And I think a big part of the intent there was to get the federal government to pay back the state for a lot of the expenses we've incurred in all of everything, right? The mass amount of people we've had to take in, the public benefits, but to hospitals specifically, because that's a huge issue we see. And again, growing up on the border, Border Patrols almost every day, they have, detainees that they have from the ports of entry and holding at the ERs, and they have to, if they complain of a tummy ache, they have to take them to the emergency room, and these small towns don't have that type of infrastructure. Do you anticipate that the federal government is going to pay Texas back if we continue to give these reports on how much we're spending?
I mean, I think the federal government, from what I gather, and I don't work for the federal government, but I don't think that they're going to stop with that. I think what they're more interested in, and I think this is also what Governor Abbott's also interested in, I think, is the birth tourism stuff is really, we got to get a handle on that. Like, it's getting out of control. We want to be compassionate, we want to care for people, but you shouldn't have hospitals in the valley advertising in Mexico, hey, packages available starting at $300. Right? Like, that's ridiculous.
Also, $300. I got a bill when I had my first kid, and it was like $25,000 from the hospital.
Hey, we could have a whole other hour-long conversation about billing if you want. I know maybe
for Brooke.
Yeah.
Next time.
Brooke and I can go into that at length, because I've definitely got some very strong opinions on that issues too.
Yeah.
Well, Brooke, I'm curious, are there any other specific bills that you're looking at to help curb these costs that the legislature is considering for the 90th?
There are quite a few along the billing aspect, but not necessarily with illegal immigration and fraudulent behavior.
Yeah, anything that kind of tackles in that, getting a better grip on the fraud itself.
Looking a lot at just transparency in general and the fraud that is taken place within the intermediaries of insurance, PBMs, and hospitals as well. But the sponsor repayments is the big one on taking money back from fraud. Yeah,
we'll definitely keep our eye on that. I mean, it should be hard for anybody to fraud the system. American citizen, illegal alien, resident, you name it. I mean, we should have integrity within the system. So I think it's really great that we're having these kind of nuanced ideas. And as bad as it got under the Biden administration, I always say I'm thankful because Americans see how bad it can get now. Yeah. We know what we don't, especially, we're coming up on midterms. Trump's term was really almost to the end, if you think about it, really. And that really should leave Americans thinking, what is my vote going to get me into next time? And the biggest issue in the country right now is affordability.
Right.
And a lot of people don't really understand how the immigration thing goes into affordability. And I think this is a major, major aspect that we need to be keeping our eye on, because like you said, the fraud within the system, the abuse of the system only makes those prices go up for the Texans who really need that system to work and to have integrity. Dr. Oliverson, in closing, what do you want Texans to take away from this discussion today? If they're looking at it, what is one thing you want them to know and to understand as we go into the next session to tackle these issues?
Yeah, I think the main thing that I'd like them to know is that when people tell you in the government that people who are not in this country legally don't get free benefits from the state or from the federal government or from Medicaid, that is just flat out incorrect. It is happening every day. It does happen. And a lot of it, at least here in Texas, appears to be self-inflicted and voluntary. Some of it's federal law. We have to comply with federal law. But some of it is we went above and beyond because we wanted to, I don't know why, because we decided we were going to, right? And so that's what I hope people hear out of this discussion. We have some solutions for how to maybe unwind this. But at the end of the day, like, this really is a cost benefits analysis, right? If I am sitting in mainland China and I'm thinking, you know what I'd really like to have is an American citizen child who may be eligible to vote at some point, move to the United States as a citizen, maybe bring me with them. How can I take advantage of the current system to be able to make sure that happens? And I mean, we can make that pathway easy, or we can make that pathway less easy, right? And people are going to make choices based on costs and benefits, right? If there's no expectation of repayment, if it's no harm, no foul, come here, get the free care you need, go home or stay here or whatever, no strings attached, that's what they're going to do in record numbers. That's what I think we've proved. The only other thing I would say in closing is that there is another big issue, which I know TPPF's working on, which is probably beyond the context of this conversation, but I'm going to throw it out here because it totally ties into this whole birth tourism thing, and that's surrogacy. We have almost no regulation in the state of Texas on surrogacy. The contracts that are drawn up are essentially private party contracts, and I would say that outside of Medicaid, the single biggest area where you have birth tourism is in surrogacy, and it's happening right here in Texas, where we are almost completely unregulated on that issue. And so I know I'm working on legislation. I know TPPF's working on that. I think we're working together on that. I'm excited to work with you on that. But that has to be looked at also as part of this comprehensive package.
A lot of hot takes in this package.
Yeah.
I'm really excited to see the language drawn up. One thing I want to make sure I hit on, because a lot of people also dismiss this fact, is the emergency services, like the emergency response that it requires. We saw in 2022, 2023, Eagle Pass, specifically the Rio Grande Valley, small towns that had to take on thousands of people a day for 4 to 7 days at a time, and their ambulances. There was a small town near where I'm from where they had an ambulance on a call to take in a big group that had come in, and a woman was an American citizen who lives in that county, was in a car accident and died due to brain injury because one of the 2 ambulances in that area just was not available. And they have to cover so much more area, and I think we often look over the fact of our emergency response ambulances, fire trucks. I mean, they're all also a part of this game, and they don't have the funding or the resources to keep up with these mass influxes when they come in. So we're also looking at how can we detect or get a better grip on the cost there as well.
Yeah, I mean, you said suicidal empathy, this whole toxic empathy, right? Like, we're literally hurting ourselves and our own citizens to bend over backwards to be empathetic. And there's a human cost to that.
Yeah.
And so these are conversations we should continue to keep having. And I'm excited to work on it, and glad that you asked me to come on the show today, and looking forward to working with y'all in the spring.
Yeah, we're very grateful for your leadership. You were an excellent champion for protecting Texas kids with, I believe it was Senate Bill 14. And we want to see that same fire and passion in this fight as well. So thank you so much for letting us work with you. Brooke, you are providing a lot of the resources that go into that fight. So thank you as well for joining us today and for doing the work that you are. And that is all that we have for today. Join us next time on Spotlight.